Hello, hello. Can you guys hear me? I did not hear any of our intro music, and I cannot for the life of me figure out why. Roel, can you guys hear me on YouTube? D Cairo, can y'all hear me? Make sure we are live on Facebook as well. Okay, we're live on LinkedIn. We'll let a few people come in. All right. Tom, can you hear me okay? I will, Tom. Okay, cool. Thank you, guys. Thank you. We're going to let a few people come in here. I don't know why I couldn't hear my intro music. Who's with me live? Let me see. I'm going to let a few people come in here. What's up, everybody? Thank you guys for joining us. This is live Q&A. Thank you for the like. Thank you on Instagram for watching us. We're going to be live for the next hour or so, answering your health and wellness questions. Doc is on his way. Jerry in UK, what's up? Edna, hello. Tell me how the knee is, Edna. Let me know how it's going. Let me know how we did over there in the Bristol office. Okay, cool. Brenda, what's up? Great to see you. Thank you. I did lift, Tom. Got a little, a little leg work in. Not a huge workout. But something. Okay, good. Thank you, Edna. All right, let's see who else we got in here. Real quick, for those with us live so far, I'm going to put this up. What Tom's referring to is this episode of the Common Sense MD. As you can see, that is Cody Warren right there of Collins Water Purification. Cody was talking to us about testing your water. Everybody's kind of heard of the reverse osmosis system and the importance of clean water. Cody talks to us just about kind of the testing process and what to look out for. And I see Tom's comment there with the, coliform, to look out for that as well in the water. I see my brother Steve's in the building. Steve, what's going on, man? Great to see you. So good to catch up with you yesterday. Julie, what's up? Great to see you. Let's see who else we got. Thank you, Roel. What's up, man?
Hey, how you doing?
I see Candy's in here. Candy, hello.
I forgot my hat, didn't I?
You don't got your hat on.
We're using these tonight?
Yeah.
I forgot my hat.
You still look good.
Well.
All right, you guys can hear us okay? We're going turning on the podcaster. What's up?
I had a good day. How about you?
I had a great day. You didn't get to play pickleball today because of the rain.
No. I was too rushed anyway. I'll play tomorrow.
Guys, I thought you guys were going to catch him right after a quick pickleball game, and I was super interested to see how you would do. Because you pickleball, you go hard. I mean, you
do go hard.
I'd be interested how like your brain works after.
I hope it still works. Probably works better. Get your everything moving and you think better.
Yeah, I like that. I see Foxy Moxie's in here. I love this from Julie. Red light therapy to match the hat. There we go, in the shirt. There we go. I love that, Julie. Great question, Candy. Thank you for that. All right, we're going to get into the questions. I see we got 30 people with us. Thank you guys for hanging out. We're going to be taking questions for the next hour or so. So if you have a question for Doc, put them in the comments. We had one come in throughout the week, and we will go over that first. And then we're going to take live questions. I see Robin Riddle's in here. Robin, how's it going?
Hey,
Great
Robin.
to see you. I posted this. I don't know if Robin saw this on her Instagram. She made this great analogy around ApoB being the license plates, and the ApoB as the license plate on all the cars. and it's a way of basically telling how many bad cholesterol particles you have. So anyways, I loved it, Robin. We posted it today.
I need to look at that.
I thought it was
I haven't
great.
seen it. I don't get on Facebook or Instagram.
Look at that. We got Carter in here from St. Pete. St. Pete is in the building. I'm a huge fan.
Vacation.
Yes, a huge fan of St. Pete. I think Jody will know this. There is a brewery down there. Starts with an M. It's in Cigar City. Mall something. But I used to love it. Shout out to the crew down there in St. Pete. Hope you guys have a blast.
Do you drink beer and smoke cigars? I thought you were trying to be healthy.
I am not. That was a long time ago. That was a long time ago. All right, we're going to take questions. I see Rachel's in here. Rachel, so good to see you. Wes and Rach are in the building. Send our love to Robbie. We're going to get rocking and rolling. If you guys got a question for Doc, put it in the comments for us. This came in over email. Thank you so much for the email questions to get us started. I may be having kidney issues. Had my first gout attack. Uric acid test showed only 4.6 level. And my pee is often foamy or at least bubbly. Any supplement/diet suggestions? And I'll add this. It seems they're coming in for an appointment in November. Any labs that need to be done before this appointment? Let's start here.
Yeah, so foamy urine. You had your first gout attack. That's a normal uric acid test, but you still had gout. There is something called pseudo gout that you may have had that might have not been true gout. It hurts about as much, but there are other forms of gout than uric acid deposits. So, this may tie in. If you have foamy urine, a lot of times it means you have a kidney problem that is causing you to pee out protein in your urine. You may have some kind of nephropathy. You don't freak out or anything, but definitely before you come in, you need a urinalysis, and you also need a CMP, which is a complete metabolic panel, so we can assess your kidney function. And that'd be a good place to start. There's all kinds of different little kidney diseases and nephropathies that need to be evaluated. Interesting. My dad had a proteinuria problem himself during the latter part of his life, but it was well managed, but it can even make you anemic. So get a CBC, CMP, and a urinalysis. You can do them all in our office because we need to find out why you have that. As far as supplement diet suggestions, I hate to restrict your protein because I don't know if you're losing protein through your urine or not. So I would say right now, drink a lot of water and let us work this thing up and see. I don't know other symptoms you might be having, like urinary frequency. If you've ever had a kidney stone, which could be calcium oxalate or could be a urate stone, which could tie into gout. But so I hate to go telling you something crazy until we work it up thoroughly and find out what's going on with you. Hopefully it's normal. I mean, there can also be some normal reasons for foamy urine, but like not drinking enough water, being dehydrated. So let's work it up and see. Hopefully you're feeling okay, and it's not going to be that difficult to work up to see if you have some kidney problems. It'll be an easy workup.
Can you say those three tests one more time?
CMP, CBC, and just a urinalysis.
And urinalysis. Okay.
That's where to start.
I hope that helps. I appreciate the question coming in, and I love these types of questions where if you're coming in for an appointment or if you just had an appointment in the last month or so and have a follow-up question, It's a great way to use this this Q&A we do every Tuesday. So I really appreciate that question, and I hope that helps. We're gonna, I think we're gonna go ahead and get into the live portion of the show. So if anybody here has questions for Doc, put them in the comments. I see TJM's in there over on Instagram. Thank you for being with us on Instagram. And I see Connie Lynn's question. I see you, Rebecca. Interesting. Rebecca tried a DMSO IV. That's interesting.
How does that work?
One, should we get an update from you on your DMSO experiment? Is it an experiment?
I'm working around with different forms of it, concentrations and some things. But yeah, I want to do a podcast soon. I keep saying that, but I will. I'm just kind of I ordered a bunch of it, and I'm kind of diluting some of it, combining some of it with aloe vera, and combining some of it with ketoprofen. Just a few things that just working around, but that's interesting to do it IV. You can do it PO. Some people do it IV. You have to know what you're doing. But yeah, give us some good feedback on that, because if you read a lot about DMSO, it's a tremendous, it's really a tremendous help for a lot of different conditions, but you have to do it right for sure. And you certainly, most people use it as a cream to bring, as a vehicle to bring other things into your body. If you put it on your skin, which you should do a patch test to see if you're going to have a problem with it, which is rare, but it should feel a little warm. And when I mix it with the still water, it immediately gets warm. It really heats up the whole bottle, then it cools off. But
does it burn when you put it on?
No, you can feel a little heat from it.
Yeah.
But it works pretty well. I've been using it on my knee and my back. But you want to make sure the area is clean and that you don't have anything on it that you don't want to be carried in with it. Like if you use certain lotions that have a lot of perfumes in it, you don't want that, because it'll bring it into your system. You can, you're getting real DMSO when you put it on your skin, and in about 5 seconds, you can taste the sulfur in your mouth. One thing about DMSO, a lot of people, because it smells bad when you put it on your body. So that's why a lot of people don't like it.
That's interesting. You can taste it?
Yeah.
And you're putting it on like your knees?
Yeah. Yeah, it goes in quick.
Goodness. All right, we're going to keep talking about it. We'll get to your question, Rebecca, here in a second. I see Jack's in the building. Jack, what's going on, man? Diane's in the building. Hello, Alyssa over on YouTube. Thank you guys for hanging out. I see Terry's in Guatemala at the moment.
Hey, Terry.
Shout out to
those
Gary.
kids out.
I love it. I love it. That's amazing,
He's
Terry.
a saint,
You're the best. He's the best. Terry, thank you for being with us as always. All right. And real quick, if we have any first timers here, let me know in the comments. This is your first time. Say hello. Let us know where you're from. We'd love to talk with you. Okay. Let's go to our questions. If I can find any, if we have some, we might not have it. There we go. Candy's got a question. Thank you, Candy. The question is, can I take 2 of your magnesium caps, one I guess one in the morning and one at bedtime? I only take one at night, but legs still cramp. So this is the magnesium, the Dr. Rogers magnesium.
You really should take 3 of them at night.
All at once?
Yeah. Mm-hmm.
Okay.
Yeah.
So Candy, that's 3 at night, and hopefully that'll solve that that issue right there.
And make sure your electrolytes are okay. You're consuming enough potassium, enough sodium. Another little trick before you go to bed, if it's cramping at night, is to stretch out really good before you go to bed. And don't let your feet and legs get cramped under tight sheets. And some people use a little tonic water. It seems to help. There's a little quinine in that. So some of the tricks. But take 3 of those magnesium capsules at night.
Candy, thank you for the question. I hope that helps a little bit. I see Denise is in here. Denise, hello. So good to see you. Thank you for being with us as always. All right, let's keep going. Thank you for that question to start us off, Candy. Let's see if I can find one. let's get on to Rebecca. I don't see one before Rebecca's. If I'm missing one, let me know. Rebecca's asking, I tried DMSO IV and it made my lungs and liver feel funny. Is there something about it to not take for certain conditions? Is it the same as glutathione? So this is a good opportunity to continue to talk about DMSO.
No, it's definitely a different compound than glutathione. Sometimes we have done some IV glutathione pushes slowly after giving an IV cocktail, say like a Myers or so on and so forth. But yeah, I've never tried DMSO IV, and I'm hesitant to do it that way unless it was a real emergent situation. That's kind of, I think, a little bit maybe dangerous to give it IV unless you've done a lot of it, have the proper dilutions, and you got to think, why am I doing this? It's kind of like, I wouldn't want to get an NAD plus IV either. A lot of these boutique IV places are doing that, but you got to really be careful about it. It'll make you have, tight chest, and it's just a scary thing. You have to really infuse it so slow. You should hear Peter Tia talk about it, and some of his experts. They really do not like NAD plus given in an IV. Mm-hmm. So you have to be careful. Of course, glutathione's I think safe to do, but IV DMSO, that's just something I probably won't be doing. But if you read a Midwestern doctor's blog on DMSO, it's pretty interesting. He does some of it IV for different things like stroke and heart attacks, things like that. But has a lot of great healing properties. But if you're getting an IV, you better get it with somebody who's done it thousands of times and knows what they're doing with the proper dilutions and all. I'm scared of it.
Now, it's not the same as glutathione.
No.
Okay.
It's totally different.
Okay. Rebecca, in the comments, let me know if that helps a little bit, and if we need to. It was naturopath, didn't know. Okay. Yeah, we might. It sounds like maybe be careful. It seems. Rebecca, I hope that helps, and let me know in the comments if there's any context we need. Let's get to Connie Lynn, and then I'm going to get to Denise. I see Denise. Oh, I see Raleigh's in there. We got Celeste. Hello, guys. So good to see you. All right, let's get to Connie Lynn. A tetanus shot due. Do I still get one? I love this. I love this question. And, I know we've gotten a few about the, what was the other one?
Flu shots?
No.
DPT?
The stress. When you get stressed, they flares. Not tetanus.
Related to
It's a, I'll remember it. Let's answer this for Connie.
I don't know what he's talking about. Well, I practiced for 40 years. I've never seen a case of tetanus, so I'm not getting another one. I just don't think it's needed personally. I just wouldn't do it.
Right.
I mean, if you worked around horses all the time,
shingles. That's what it is. It's shingles. Okay. Yes. Thank you, Rachel.
Yeah. If you worked around horses all the time and rusty nails, and possibly, you could get one. I just don't see it. Not that when you get it, it's very hard to treat. So, but if you're just a normal person that doesn't work on a farm around a lot of horses, I don't think it's necessary. I'm trying to guess how old you are. You look like you maybe, from your picture, 40. Would you say 40?
40 tops.
35.
40 tops.
Maybe
38.
Maybe
38.
40 is too old.
Maybe 38.
But yeah. So I don't think so. I wouldn't personally. That's just my opinion.
Connie Lynn, I hope that helps a little bit. I'm going to get to Denise over here. Denise, thank you. Does PM have NAC supplements?
Yeah.
It's the life extension form, right?
We have life extension. Yeah.
NAC. And NAC's an interesting one because is it just one N-acetylcysteine?
Yeah, we put it in our immune formula, the ones that
yeah. And you shouldn't take both, right? You shouldn't take the immune.
You could. I mean, you could if you're sick. You can take up to 1,200 milligrams of NAC. which is really useful. You think of it as a detox, but it's good for people that drink a lot of alcohol. Like if you overdo it on the beer, you should be taking a NAC.
It's true. I mean, can you tell we're father-son? He's getting on me right now. And I'll probably have a beer.
Probably if you're taking Tylenol, you ought to take NAC.
Yeah.
All the things about Tylenol now, mucomist is something we used to give to kids that came in with Tylenol overdoses. And that's what it is, N-acetylcysteine. It's a prescription, life-saving medication that we used to give kids who came into the ER with Tylenol overdoses. But too much Tylenol can kill you.
Yeah.
This thing about Tylenol is not anything new. We've known about the dangers of Tylenol for a long time. Plus the fact when I don't even like Tylenol. When I take it for headache or sprain it never works for me. I think it's worthless for me. It is good to reduce a fever in a kid, but again, unless the fever is really high, you don't want to reduce it. If you have a virus or something, unless it gets up to 103 and a half, 104 to prevent a febrile seizure, you don't want to treat fever like everybody does. Yeah. Oh, you're a little uncomfortable. Let's give you some Tylenol. Let the fever do its work. To fight the virus. That's your body's own way of fighting the virus. So, my opinion.
Thank you so much for that question, Denise. Denise is telling me not to cut back on the alcohol.
Yeah, he doesn't drink too much.
All right, let's keep moving. I see. Where are we at? Let's get to Jerry here over in the UK. Looks like I've got to have more radiotherapy. Shoot, I'm sorry, Jerry. Only finished in July sessions of 10. This time on my torso. Can I take ivermectin? If so, what's the best dosage per day? What's your thoughts on this for Jerry?
We do it weight-based, but on average, for cancer patients, we use about 30 milligrams 5 days a week. With radiotherapy, ivermectin's okay. You just don't want to take artemisinin if you're getting radiotherapy. That's a no-no. But ivermectin's okay. Again, your oncologist may not know much about it or like it particularly. Sometimes they don't like you doing off-label stuff.
Jerry, we're thinking about you. Keep us posted with how you're doing on these Q&As. Thank you for being here as always. Let's see if I'm missing. So let's go to Teresa. Thank you, Teresa. Teresa is asking, could you please discuss L-methylfolate, what it does, what it's for, and the pros and cons of taking it? What should be starting dose? L-methylfolate is something we talk quite a bit about. What's your thoughts on this one?
Yeah, I'll certainly take it. One thing that, that's been in the news lately too, because you have leucovorin, which is folinic acid. You have methylfolate, L-methylfolate, and then you have folic acid. A lot of people have this genetic mutation called an MTHFR gene, in which we check on every Cleveland panel that we do. And if you have a particular very common mutation on that gene, the 677T form of it, then it can cause a lot of problems. With methylation, which is basically it's a cycle. It's hard to explain. You can go to some of my podcasts where I talk about this on that gene. But basically, it means that you have a real hard time converting folic acid, which is vitamin B9, the most common form of it that most people tell you to take. It's folic acid. But basically, when you have this gene, and it's very common, probably 30% of people have it, you can't convert folic acid to methylfolate, which is the active form of vitamin B9. As you know, that's a very important vitamin for your brain. I mean, every pregnant woman, they immediately, when they find out they're pregnant, they go on folate. Most of the time they say, take folic acid. Or for dementia, take folic acid. But really, for most people, they should be taking L-methylfolate because it's the end product. You don't have to worry about getting converted to the active form. And so many people can't. So when you get a buildup of folic acid, it's bad for your brain. If you're one of the people that can't turn it into the active form of B9. And that's why you see all these neural tube defects. And now they're kind of linking it maybe to autism. Leucovorin, which is we've been using for years and years. This is nothing new. Most people think of that as a drug that we use to combat some of the side effects of chemotherapy, like methotrexate. Anybody on methotrexate needs to take folate, and not folic acid, but folate. But leucovorin is a special form of folate called folinic acid. I have a few people that take this, and it gets deep in the woods because when you have the MTHFR gene, say you have a double mutation, and you also have mutations on something called a COMT gene, like a Val-MET mutation, then it may be even better to take folinic acid than it is methylfolate. But for most people, methylfolate is the form you're going to use, because methylfolate and folinic acid both cross a blood-brain barrier, whereas folic acid has a real hard time with that. So you're taking it for your brain. So yes, get your MTHFR gene type taken, and because there's another test you need to look at if you have that. It's called a homocysteine level, which is really an inflammatory amino acid that builds up and can cause blood clots, heart attacks, miscarriages, strokes. It's dangerous. It's really more dangerous to have a high homocysteine level than a high cholesterol level, in my opinion. And yet most doctors don't even know what it is, but it should be a standard test. It all has to do with this cycle of methionine, homocysteine. You want homocysteine turning to methionine, which you can actually utilize. Homocysteine you can't, and it's inflammatory. So I know we're getting kind of deep in the woods, but that's the active form of folic acid is methylfolate. So start taking it.
Yeah. If anybody has any follow-up questions around that, please put them in the comments. The other thing is Robin did explain this episode on MTHFR that does a great job of describing this process. If you just search MTHFR Performance Medicine or MTHFR Robin Riddle, it will show up. But this seems to be such an important thing to understand in the integrative functional medicine world.
Yeah, it's something that's basic.
Yeah.
You need that checked for sure. It's very common.
Teresa, thank you for letting us talk about that and the question there. If you guys have any follow-up, let me know in the comments. We're going to move to the next one here. I see Lisa R. Feathers. What's going on, guys? Thank you for hanging out with us. Krista, hello. All right, we're going to go to our next question. That was Teresa. Let's go to D-Lynn. Speaking of Tylenol, D-Lynn has a great question. With all the negative findings on Tylenol, what's best for a headache, since ibuprofen isn't very good for us either? I also had this question, D-Lynn, so thank you for asking it.
Yeah.
What's your thoughts on this?
Yeah, I mean, even ibuprofen, which I think works better, if you take them rarely and have normal liver and kidney function, I think it's okay. Take it with food. I had a guy that had a GI bleed today. He followed up with me in the hospital. It's an interesting case. But his hemoglobin was down to like 6. He had to have 2 transfusions. It was from taking too much ibuprofen.
Really?
Yeah. So you can, and plus if you take a lot of ibuprofen, it can increase your risk for a heart attack. So you need to be limited with it. Again, I prefer you take other things like turmeric, which is curcumin, MSM. Occasionally you may need something a little heavier. Again, I don't like to use a lot of pain medications anyway. Your body has a tremendous way of releasing its own endorphins, but sometimes you need something. But you're right. There's not a lot of great choices out there for everyday pain that is even over the counter, besides some of the more natural things that we use. We have that pain formula, which I like. Because you get this old, you're going to have some arthritis.
Yeah.
And you're going to have pain in your back and your knee. There's very few of us get by without that. So, try those things. Also, I like heat. I like ice at different times. I like a TENS unit. I like acupuncture, dry needling. Sometimes it just depends on what kind of pain it is. That's a great question, though.
For a headache in particular, would you start with hydrating more? Start there, maybe close your eyes, rest a little bit.
And then again, if you're having migraine headaches, there's great treatments for migraine headaches now.
Yeah.
We used to have the old triptan family, and like Maxalt and Relpax and Imitrex, those. Now we have the new classification, which includes Ubrelvy and Nurtec, which work, I think, better with way less side effects than those other ones did. So, you need to find the root cause of the pain.
Yeah.
And then there's a lot of good alternatives that you can use. And I like, certain creams. DMSO is a great one.
D-Lynn, great question. Thank you for asking that for me. I needed to hear that as well. So thank you for the question there. Let's go to D. Cairo. D. Cairo's been with us all day. Let's answer this question for him. Would you recommend a PEMF mat for systemic inflation, or just boswellia, curcumin, and black seed oil, or both? I love this question.
I say both. Yeah. They're both great. I love the combination of that. And what else do we put in our pain formula?
Let me pull it up here.
Flip it up there, and we've got a kind of a unique pain formula that
there we go.
I came up with years ago, and here's what's in mine.
It's got turmeric, and make sure these doses are right. I messed up one of the dosing in the super. Does that look right to you? Bromelain, boswellia, Paractin's the one that you really like, right?
Yeah, Paractin's something nobody hears about, but I think that's the secret sauce in that pain formula. And again, this one's, I take it daily just because I think it's good, and because I have arthritis. So this is not something you have a severe headache with and going to pop it and make it go away. But yeah, I think the mats are good. I think those are good substances. I'm all for it.
D. Cairo, thank you for the question. Let's get to Jack. Jack, remind me where you're at. I believe you're in California. In my head, you're in California. So I hope I'm not wrong. Jack is asking. A friend of mine has.
That'd be a good song. In
Jack?
my head, I'm in California.
Yeah.
Reminds me of the old Mamas and Papas song.
I know. This is
California Dreaming.
California Dream. I'm California.
I need to play that on the guitar.
Jack would ask you to play it on the guitar.
He probably would.
He would ask you.
I don't know it though.
A friend of mine has costochondritis and is pretty miserable. What is that, and what causes? That's so interesting. This came up on the show, I believe, last week as well. Costochondritis. Explain what it is.
It's a very painful condition of inflammation in between the ribs, the cartilage in between the ribs, and it usually is a result of straining it. I have seen a virus cause this, however. But it hurts to breathe. It hurts to move. It takes a while to get it gone. So it's usually some kind of injury or strain that they've done. There's our dog making noises. So, you could even, have a cough and do that. You can break a rib coughing. Localized therapy. Some people will even treat it like they would treat a rib fracture, and put a rib belt on to kind of act as a splint. But anyway, my phone went off. Local, I think ice is a good therapy. DMSO is probably going to be a really good cream to use on that. And again, remember, you can order DMSO over the counter. Go to the DMSO store and get it. And my favorite combination of theirs is a 70% DMSO, 30% aloe vera gel. But it's a tough one. It's going to take some time. And again, he may be one, or she may be one that needs some non-steroidal anti-inflammatories.
It sounds miserable.
Painkillers.
It sounds like it'd be hard to breathe. It sounds awful in many different ways.
Yeah, it's pretty painful. It's usually not too serious, and you get over it, but it's painful.
Jack, Jack is in Florida, and I had Jack in California. Well, Florida's incredible too. I'm super jealous. That sounds awesome.
I'd rather be in Florida.
I think I would.
I'd rather live in Florida.
He said he left. He said he left Cali.
Thank God you left Cali. I mean,
all right, Jack. Let me know in the comments if that helps. We're going to keep going. Let's get to Lori. If you have a family history of breast cancer, should you take progesterone?
Yeah, for sure. As long as it's micronized progesterone and not medroxyprogesterone. That's a great question, because there's a lot of misinformation about hormones and breast cancer. Everybody got scared off of all hormone therapy when the WHI study came out in 2002. That was originally it was a cardiovascular study, but they had a lot of women in this study, and so they studied a lot of different things, and one of them was hormones. And in that study, they were using Premarin and Prempro. Of course, Premarin is pregnant horse urine estrogen, and the Prempro added the progesterone. The former progesterone was medroxyprogesterone, which is a bad actor. It's a terrible medicine. I would never use it on anybody. As a matter of fact, there was an article today about the Depo-Medrol shot.
Really?
That's what it is, and how it's linked to some bad stuff. It's a birth control shot.
Huh.
Never. I used to prescribe it some back, 30 years ago, but never would do that now. But anyway, so they did the study, and everybody got scared. Doctors and patients got scared off, because the results showed that hormones cause breast cancer. And if you go back and look at the study, it's been refuted. The first thing is, half the women in that study were smokers, half were obese. And even using pregnant horse urine estrogen, using the Premarin only arm, the women that had hysterectomies that didn't necessarily need progesterone, so there was less breast cancer in that group than women that didn't take anything. I mean, not only didn't cause it, it was in favor of preventing breast cancer, among a ton of other stuff. Now, of course, we use bioidentical estrogens, and we don't use estrone. We use usually estradiol or estriol, or combination biased. But in the arm of the study that women took Prempro, which is the horse urine estrogen plus medroxyprogesterone, which is a totally different compound than micronized natural progesterone, which you can even get over the counter. Anyway, in that arm of the study, the incidence with Prempro, the incidence of breast cancer went from 4 women per 1,000 not taking anything to 5 women per 1,000 taking Prempro. So,
and that's the bad form.
One more woman out of 1,000 had breast cancer on Prempro. So there was a medroxyprogesterone that caused a very slight increase in it. It's a horrible medicine anyway. Nobody should be taking that, in my opinion. We have the safer form. So, and besides, family history is important, but that's not the most important factor with breast cancer. I think it's 1 out of 7 cases have a positive family history. So there's more important risk factors for getting breast cancer, and that's obesity, alcohol, smoking. So it's certainly, you can take progesterone, micronized progesterone, and you can take also the safe forms of estrogen when you need it. Again, you're going to need progesterone before you need estrogen, because it drops out quicker. So I hope that's a brief little summary of don't be, know what you're doing. Get your mammograms, thermography, MRI, whatever, diagnostic ultrasound, but get your screenings and get your hormone levels checked. Certainly, progesterone, in my opinion, the natural micronized is very safe.
Lori, I hope that helps. It's such a good question, and that's something I see a lot in our comments on our posts. A lot of it is, I have a family history of breast cancer, or
now, if you have breast cancer yourself that's
right.
hormone positive, then you don't take the hormones. You can take testosterone as long as you look at, you look at the levels of estrogen that may aromatize too, but that didn't cause it. But so.
Lori, I hope that helps. Let me know in the comments if we need to clarify anything. It's such a great question. I'm going to get to Sarah here. Thank you, Sarah. I'm 45 years old, and after my Cleveland Heart panel a few years ago, one of the supplements recommended was pycnogenol. It has really helped my blood pressure along with resveratrol over the years. But if I get cut, I bleed like crazy. I read where you shouldn't take pycnogenol for more than a year at a time. Thoughts, and if true, how long should you stop before starting it back up? This is Brandon. So Brandon, thank you, man. Thank you for the question. What's your thoughts on this?
It's interesting. Yeah, you should probably give it a break, but you don't need to take it a year. What I would do is give it a break for like a month at a time, 2 or 3 times a year. If it can have a little bit of blood thinning properties. We use it a lot for ringing in the ears. Nothing seems to help that much, but yeah, but it's a good little all-purpose little supplement. Interesting.
Brandon, let me know if that helps. If we need to go deeper on any part of that. But thank you for the question.
Can cause it.
Oh, really?
Make it their blood thinners. Curcumin can increase your bleeding time a little bit. A lot of supplements can really thin your blood, but if it's causing you to bruise or bleed, you want to not take it.
And that's why you always say on the show, when you add something to your regimen, add something one at a time, so you can kind of pinpoint, if something were to change, what the culprit is.
Yeah, medications, even supplements can, if you have something going on that you can't explain, I always ask, have you tried anything different lately? A medication or even a supplement that could be the cause of it.
Yeah.
And a lot of people are just over medicated.
Yeah. Thank you so much for that question, Brandon. Let's get to eCar Reviews. eCar Reviews is asking, can oral minoxidil make you lose more hair, or how do you know it's working? That's a great question.
Yeah, it should. We use it for prevention of hair loss. So if you're losing more hair with it, stop it. Doesn't make any sense. It's a dihydrotestosterone blocker. And it's kind of works in a weird way. It's the same as Rogaine, except you're taking it orally, and I think it is more effective orally than topically. Nobody wants to goop on their hair all the time, but just kind of monitor it. If it's not working, the other things you can do are you can take a good hair vitamin that has biotin and some of the other stuff that we put in them. And you can take finasteride, another more potent DHT blocker. But it shouldn't. But if you're having any kind of thing like that, stop it. But be surprising.
eCar Reviews, let me know if that helps. Thank you for that question. I'm going to get to a few on Instagram here. Thank you guys on Instagram. Let's get to 19 Tennessee 86. That's my year. They're asking, is norepinephrine a safe BCP? And I hope I'm pronouncing that
birth
right.
Control pill. Yeah, I mean that's the most common one. I don't like birth control pills after you get 45 years old. That's for sure. And certainly a synthetic hormone. So. But for some people, they need to take it to prevent pregnancy, and that's their best option. Some people, but it is a synthetic progestin, and can increase your risk of having strokes and blood clots. So again, it's not common, but it happens. So if that's the only way to regulate your periods or prevent conception, then you want, it's the most common ingredient in birth control pills.
In 1986, if you want to dig a little deeper, Robin Riddle specializes in functional fertility. We've done a couple different episodes on birth control. If you just search birth control Robin Riddle, it'll show up on our YouTube channel. Thank you for that question. Let's get to Bentha here. My mother's 82, diabetic, and is having pain and swelling in her knees. Would you recommend your pain formula for her?
Yeah, I think it would help her. I always like to ask what medications people are on in case they're on potent blood thinners. But she may be one that would like to use some topical DMSO or some of the pain creams.
That I hope that helps. I'm going to get 1986 is asking, along with that is Wellbutrin safe to take with a noradrenalone?
Yeah. Wellbutrin's, as long as you don't have a seizure disorder, is the main contraindication using Wellbutrin. But yeah.
All right. Thank you, guys on Instagram. If y'all have questions, put them in the comments. I'm looking over here as well. I'm going to go back to YouTube and Facebook here. Let's get to Julie. Thank you, Julie. And then I'll see Loretta. What is good to help you go to sleep when you're struggling? It's a great question.
That's a good common question. There's many things you can do. The first thing is sleep in a cold, dark room without any electrical devices in your room. Most people that can't sleep, a lot of times they have a hard time turning their brain off and they get this mind chatter. I like L-theanine for that. There's good combination sleep aids like valerian root is a good one. Ashwagandha, rhodiola. You don't want to get on sleeping pills if you can help it. I'm not against when you're traveling or an occasional use of Lunesta is probably my favorite prescription sleeping pill, as long as you don't take it all the time, because it works. It's a pretty clean drug compared to something like Ambien. But always wear yourself out during the day with exercise, not at night, but during the day, and you'll sleep better. To get an Oura ring or something like that, or Whoop ring, and actually measure your sleep, and you can tell a lot about what quality sleep you're getting. I like, a Sleep 8 bed mattress cover, which cools your body down at night. It uses AI to figure you out, and has, different sides of the bed will be different readings depending on what your particular biorhythms are. But I love the Sleep 8 bed, and it gives you some pretty good stats too. Really, as far as sleep goes, way better than my Oura ring does. And so when you jump in the bed, it's kind of warm, and as you fall asleep, it goes down and it chills you off at night. You don't even know it, and as you wake up, it kind of slowly warms back up.
Would you suggest having two big dogs in the bed to help with sleep?
No, that's bad. That's why I can't sleep. That's a good point.
Julie, thank you for that question.
Sleep's a struggle.
Yeah. It's something we all kind of have bouts of battles with. But sleeping is, if you can sleep well, it's a superpower. Loretta is asking, if you have severe seromas after surgery with drain still in, what suggestions to move this type of inflammation?
The drain should be doing it, but if it's not, you might consider getting somebody that does, lymphatic massage. There's some techniques they use, even some devices they use that are a little bit different. But yeah, that's a toughie. They will go away, but I'm not sure if you can speed it up a whole lot. Be patient for one thing. But yeah, movement, moving around a little bit. I like to jump around on my little trampoline over there, mini trampoline, but you probably can't do that right after surgery. But after you get the drains out and all, you certainly could start a little bit of that and think about lymphatic massage.
Loretta, thank you for that question. Let's get to Raynette here. Thank you, Raynette. When I get the rare headache, usually in the middle of the night, I take a 455 milligram capsule of feverfew and a 100 milligram capsule of magnesium. Works great and usually very fast. Your thoughts on that combo, particularly regarding the feverfew?
Yeah, I love it. Works great for pain. We don't talk enough about feverfew, but it's
I've never even heard of it.
You can get it at any natural food mart. But yeah, magnesium certainly, just wonderful.
That's interesting because right now when I get a headache, I usually take an ibuprofen. I'd much rather, this combo seems way better,
safer.
Yeah,
you can also use DMSO topically
on your head.
Mm-hmm.
Interesting.
Even for migraines, yeah.
Raynette, thank you for that question. Let's get to my brother Tom. I have what feels like a fluid buildup on my elbow, only causing a minor amount of pain. Should I be concerned? So a little fluid buildup. I feel like I've had something like that. Would you drain it?
Yeah, you can have bursitis. I've drained a lot of those in the past. They come right back though. You probably have a little synovitis. You've got or bursitis, whatever you want to call it, from lifting weights, especially the kind of weights you lift. It's not uncommon at all. So you might want to, if it hurts to do it, back off just a little bit on some of your elbow flexing exercises, pull-ups, push-ups, curls, things like that. Gosh, sometimes they can get huge. I mean, I've seen them as big as a golf ball or tennis ball. Golf ball is about the most common size, but I've seen it as big as a tennis ball. You can drain them and get a lot of that fluid out, but unless you wrap it tight and don't do anything, it'll come right back. It'll be in your office the next week getting it done again. It's immediate relief. But if it's small, just kind of take it easy and ice it down. That may help a little bit. If you have somebody stick a needle in there, make sure they do it sterilely and they know what they're doing.
Seems like Tom's had an injury, like an incident as a kid. So maybe that's like a
probably a small tear there that kind of leaks out towards the surface in your olecranon bursa.
Tom, let me know if that helps. I'm gonna. I saw one more. It's a great question from Deal. Will your formula help with a sudden headache when rest isn't possible? I'm kind of thinking it doesn't help for that sort of thing.
Yeah, it's not an acute formula as far as my pain formula. It's more of for chronic pain.
Yeah, maybe D-Lynn would it help her with what Raynette's doing?
Magnesium.
This might help D-Lynn. 455 milligrams of feverfew and 100 milligram of magnesium.
Try that.
Yeah, try that. Thank you, Raynette, for that. Real quick, guys, I got a few of you here. I want to put this up. Our team just pinged me there. Longevity Masterclass is happening in Knoxville. You can see there it's at the Cherokee Country Club. If we have any Knoxville people, we'd love for you to come. My brother is speaking. He's going to be talking on medically assisted weight loss and hormones. And they're also going to be with Stretch Fusion, which is a friend of ours in the Knoxville community. It's lunch, so the fee will cover lunch, and you get to talk with Andy and talk with Stretch Fusion. Anybody's in Knoxville, I'd encourage you guys to go and go to this lunch there. And at the very least, you get to hang out with my brother, which would make me very jealous. That's the reason I'd want to go. So I'll put this up a few times over the next week or so. But shout out to Andy and the team at Stretch Fusion for doing the longevity.
Well worth it. I wish I could go to that.
I know. Longevity Masterclass is happening at Cherokee Country Club. Let me get that date one more time. October 9th from 10 a.m. to 2 p.m. And it comes with lunch. So if you have any questions around that, put in the comments. I'll make sure somebody helps you out with that and get you set. Thank you, team, for the reminder there. All right, let's see if I missed anything, and let us know in the comments. We're about to hit our 8 o'clock time period. I see Carolyn's in here. Carolyn, hello. Great to see you. Let us know in the comments how we did, and if you have questions around the Longevity Masterclass with my brother in October 9th, let me know. It seems like Ivy might take a field trip down there from JC.
You should.
Ivy was mentioning she was putting together some peptides today. I love it.
She mixes a good peptide.
She mixes a great peptide. And can you guys see? Can you guys? No, you guys can't see. You want some? You want some camera time?
I was trying to get him.
Dave, thank you, brother. Thank you for that. Thank you, Roel. I'm going to turn off the podcaster. I don't think we have any more questions here. I see Dooley, what's going on? Great to see you. Thank you for joining us this evening. If you guys have any more questions, we do this every single week. We do live Q&A 7 to 8 Tuesday nights. So we really appreciate y'all hanging out. I'm going to put this up from Raynette. One, this is for me. I get solar ray feverfew from Life Extension. Thank you for this, Raynette. That's going to be something I try. My brother, Mark, I got to call you. I'm calling you, Mark. I am calling you. And thank you for the 10. I'm going to call you. Julie, thank you so much. Karen, thank you so much. We appreciate everybody that comes every single week. Thank you for the newcomers this week. And thank you to you. I give you a 10.
Thank you. I give you a 10.
I appreciate this, man. As you know, this is my dad, and we get to hang out. We get to hang out on Tuesday nights. How cool is that? All right, guys, we love you. We'll be back next week. Rachel wants to see the dogs. Ike, come here. Ike.
All right.
You're wanted.
There
he is.
There he is.
There he is. Come on.
There he is.
Come on. Come on.
He's a sweet one.
Hey, come on. You're
He's a little shy.
You're shy?
He's on the spectrum. I need to give him some Luke of Orange.
Ike, you're perfect. Ike's perfect. All right, guys. We love you. Thank you, my brother Steve. Thank you so much. Guys, we will be back next week, 7 to 8 on Tuesdays. If I can find my outro, I'm going to get my outro. All right. Hold on one second. There we go.
Don't go away.